tolerate the pain better than
No,
others.
no, because if I were to do the same thing, these are the same people who are like, ow, the needle hurts. It's not that. Here's what happens. When you get a tattoo, right? Of course it hurts. Your brain goes, what the hell? And then you go, oh, isn't that cool? Right? And then you go, isn't that cool? And then your brain goes, this is bad. And you go, isn't that cool? And you go, bad, bad, bad. Isn't it cool? And your brain goes, it must be cool. And your brain puts you into almost a trance. Your brain puts you in an altered state of reality when you're getting tattooed. That's why people like, it feels good, right? Feel like it's, you know, like so when you ask this person, it's a complicated answer because you do kind of go into like this little trance. You go away, block it out is what you call it. Except that you probably aren't able to block other things out. You can learn to control pain. You can learn to control your galvanic skin response, your blood pressure, your heart rate, your breathing. In fact, I creep doctors out.
Okay, I got a question. I got bitten by a tegu lizard. Yes, tegu lizard.
That was
Yeah. Anyways, and I was sitting there with my fingers in its mouth for about 5 minutes until I was sitting there calmly, like sitting there talking to everyone in my clinic. I'm like, there's a lizard on my fingers. And I looked at everyone else and they thought I was joking. I'm like, there's a lizard on my fingers
holding
right
your
now.
finger up.
Your brain releases.
And then I was like freaking out.
Yeah.
And then I just like, there's a lizard on my fingers. And then after the fact, I cleaned myself up. I started laughing.
Yeah. Your brain is. Anybody been seriously injured or broken bones, things like that? Does it hurt right away?
No.
No, you just go. I was looking at my wrist. It was like sticking out, bones everywhere. I go, I could wrap a knee strap. Literally, I was
Duct
trying
tape.
to. Because your brain can protect you from that. Your brain has a lot of abilities. You learn to use your brain. You don't need drugs. But here's the thing. I'll also give you a little word about marijuana. I will preface this with I don't use marijuana because the minute that you say anything about marijuana, everybody thinks you must use it. First of all, marijuana is not an addictive substance. Second of all, if you were my friend, not my student or my client, and you were fixing to take a painkiller, an anti-anxiety, trazodone, a sleep drug, a nausea drug, I will look at you and say, do not take that drug your doctor gave you. Take pie. Why is this a safer drug? I would not say that to a student and a client, of course.
Because it's a plant, not a man-made thing.
Not a man-made thing. It's not addictive. All of those things are addictive.
Mm-hmm.
It's not addictive substance, number one. Number two, it's much, much better for you. Nobody's died of a pot overdose. You might have died of a Cheeto overdose. But
Cheeto?
Associated with pot.
Oh, yeah.
Gluttony. It is by far, far safer than any of those drugs. If you know what's in it. Again, like, find somebody that you know that grows it, that does crap in it. We know that about marijuana. It's just that we're too stubborn.
Mm-hmm.
Keep saying it's bad, 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 bad. Honestly, it's way better for you than most drugs. And it will treat a lot of things. A lot of mental illnesses that we give you really bad drugs. The drugs we give you to treat anxiety are no joke. They're like horse sedatives. Trazodone was originally a horse sedative.
Yeah.
That's what we give you, to make you feel calmer. Yeah, no. Valium, no joke. They originally used it for like surgical procedures. Like we just go, this will help you out. Not telling you these are very, very serious drugs. They're very addictive drugs. They're not all that great for you. And if you can manage it with other things, that probably is your first choice. Pain, pot is incredibly effective for pain. Again, most painkillers, really addictive. Most NSAIDs, aspirin, ibuprofen, are not good for your stomach. So, like I said, there's an alternative. The problem is making sure there's no crap in it.
You know, you're making me very worried. I have a surgical procedure tomorrow for my wisdom teeth.
Well, they're going to give you oxycodone, likely.
I thought you were getting your leg fixed.
And
Your face will be fine.
if they are not ethical practitioners, they're going to prescribe you 30 pills with one refill. Do you need 30 oxycodone?
No.
You likely will need 3 or 4.
Mm-hmm.
Wisdom teeth hurt.
Mm-hmm.
So being in pain is bad for you too. But again, try to reduce the amount of painkillers that you take. Take a half one. Take it with an NSAID, like ibuprofen or aspirin or things like that. You're not going to be addicted to 3 pills. It's when you keep taking it. And the thing is, it will keep you in pain. So I was talking to Sid about this, who has been on painkillers for a long time with her back, and I was trying to explain to her, I said, you need to get out, when she was trying to get off, I said, you need to get off of it, it's really addictive. She goes, but I really have pain. I go, I know, but you really have more pain because you're taking them.
Mm-hmm.
All those things that your brain's causing you to have more pain because you're taking them. So you're going to keep having pain because your brain will manufacture that
Right.
to get you to keep taking the drug. She goes, but I know, but you have to live with pain for a little while. In your case, you're not addicted to a painkiller. Take the painkiller. There's not good healing that happens when you're in pain. So there's a balance between that. So eventually it was go to half, go to a quarter, take it with an NSAID, right?
Mm-hmm.
All kinds of things like that, but do not take it any more than you absolutely have to. You'll be surprised, ibuprofen is very effective.
Oh, yeah.
When you 800 milligrams ibuprofen will kill a lot of ills, unless you're like Vietnam, I'll take it.
When I went to the dentist and got my wisdom teeth removed, they gave me ibuprofen and Vicodin, like a full bottle of Vicodin. I'm like, why did you give me Vicodin? Like, I didn't even use it.
Yeah.
Just sitting there.
You might need one or two. Throw it out.
Don't throw it out.
Don't sell it.
Don't sell it.
Don't sell it.
Um,
People will go through trash. Just
Be
show
very
me.
careful. When the doctors give you things, you think Trazodone's just for sleeping, right? You think the things doctors give you are safe. They're not. Any questions?